So first of all, I want to make sure to say good afternoon and welcome. My name is Jessica Harrington, and I'm the Assistant Director for SOURCE, and we are the Student Outreach Resource Center. I see so many familiar faces, I feel like I should ask people what we do, because you probably already know. But in case you don't, we are the Community Service and Service Learning Center here at Johns Hopkins, serving the schools of medicine, nursing, and public health. So we work to get students just like you in all three schools involved in community involvement activities, be it for academic purposes or just for pure pleasure and love of volunteering and all things community. So welcome to Baltimore. I'm sure you heard that also in your orientation. So with me today I have three guests who are a part of the Hopkins community, and they are also well connected to our Baltimore community. And so you all are here, maybe some of you are thinking about getting involved. How many people are new to Baltimore? Well, all right, there you go. See? So nothing you say will be redundant. If you feel like you're starting from the beginning, it is because you are, because most people here are not from Baltimore. So again, to my left, we'll start with Megan, and you can each introduce yourselves, but we have Megan Greeley, Mark Marino, and Dr. Lenny Feldman, who wants to be called Lenny. I like doctor. Okay, so Megan, would you go first? And let us know who you are and a little bit about your community involvement experience here.
Sure. Hi, I'm Megan Greeley. I have actually just finished the MSN MPH program here at the Schools of Nursing and Public Health. And I've been here in Baltimore for 3 years. I've been involved in the community in a variety of ways, mainly through the School of Nursing, first of all in the Community Outreach Program, which is a program at the School of Nursing where I volunteered at the WIC program, which is Women, Infants, Children, it's a supplemental nutrition program. And then for the past couple of years, I've worked as a community health nurse in one of the School of Nursing run nursing centers, located actually just a block from here in a senior low-income senior building, and we are very involved in the community, and we've had lots of people volunteer there through the School of Nursing and through the School of Public Health, and it's been a really great experience for me.
My name is Mark Marino. I'm the Executive Director of Project Health here in Baltimore. Project Health is a national nonprofit organization that takes college students, places them in different healthcare centers to address the social factors of families. We've been in Baltimore since 2006, and we've been implementing programs at 5 various locations around Baltimore City. We have a partnership with the Baltimore City Health Department and Baltimore Healthcare Access, which is a agency of the health department that sort of addresses all of these different factors, health insurance enrollment, et cetera. And our locations are at 3 Johns Hopkins institutions. We're in the emergency department addressing these factors and really focusing on facilitating access to primary care, 2 pediatric centers, a fairly qualified health center, Baltimore Medical Systems in Southwest Baltimore, and also we'll be starting a new program to address improving birth outcomes. As I don't know, many of you may or may not know, coming to Baltimore City has a really high infant mortality rate, twice the national average, on par with third world countries, and we're implementing a new program starting this fall to address some of those issues, address the social resource factors of pregnant women as they deliver. So mainly we work with undergraduate students, but just in the last 6 months we've partnered with the schools of public health, nursing, and medical school to implement a program in the emergency department where we have about 60 students volunteering about 3 to 4 hours a week, working with patients, identifying resource issues, connecting them, and providing ongoing follow-up to ensure they have access to things like primary care, health insurance, but also food, childcare, employment, housing, all of those other social factors.
Thank you, Mark. I'm Lenny Feldman. I'm a physician board certified in internal medicine and pediatrics here at Hopkins and have been here now for 6 years. I'm the program director for the internal medicine pediatric urban health residency program, which is a program geared towards creating primary care physicians who can take care of the whole family and deal with the myriad of social issues that affect patients in a place like Baltimore City, particularly lower income patients who are currently underserved. My involvement in the community has had a winding road over the last 6 years. I started out volunteering in a free clinic that Hopkins had opened up right about the time that I got here. I spent a few years doing that until the clinic was closed down, and then had things morph into helping to run this residency program, as well as serve as a faculty advisor for two different groups. One group is the Urban Health MedPeds Medical Student Interest Group, where we particularly are trying to get the medical students involved in the community and thinking about community issues. And then the second group, which I'm beginning to be involved with, is the Charm City Clinic, which is a non-Hopkins entity that has Hopkins medical students as well as other folks involved who are trying to help the patients of East Baltimore get access to primary care, a lot like what Project Health does, but sort of out in the community outside of a clinic setting.
Okay, thank you. Based on what you just said, I kind of want to start at the beginning about Baltimore, and based on your own experience, what would you say are the major health issues based on your time here and what you've encountered? What stands out to you? And anybody can answer.
I'll go first. I clearly have a perspective that's very much tied to the work that we do. So take that into account, my bias. But so the Baltimore City Health Department just did their own community-based survey, much of what the CDC and other agencies do, in the spring of 2009, and published that. They telephone interviewed about 1,000 residents and sort of identified a whole host of different disease as well as social factors that are really sort of determining a lot of the different health outcomes. And they published that. There's an executive summary. I encourage you all to Google search that when you get a chance. That sort of highlights a lot of what Baltimore issues are. And honestly, you could probably throw a dart at a dartboard and pick a public health issue in Baltimore. You would say that they need help on that public health issue, from violent crime, and you watch The Wire, as well as substance abuse, like I said, birth outcomes, a whole host of factors. And this community survey really highlighted things, I think, in a very unique fashion, really pinpointing sort of the health disparity aspect of all of these different issues. And while the trends were sort of decreasing, the disparities were growing even farther and farther apart. And I think in one aspect, even looking at folks who had health insurance as part of this survey, they found a 25-fold difference for those that reported an unmet health care need based off of income alone. Looking at income, education factors, the executive summary really said the city has an obligation to address these social determinants of health as a sort of a public health crisis, a public health issue to impact some of these health disparity numbers. So that's just sort of one study. The city sort of is in the process of actually prioritizing their different health issues at this point. They just have a new health commissioner who's coming on next week from New York City, who will sort of again have maybe a different agenda. So we'll kind of see. But literally there's a myriad of different issues that you could probably address. No need to even go to a third world country. You can address it right here in Baltimore City.
Yeah, and that's actually what we stress with our urban health residency when we're recruiting for new residents. Lots of residents are interested in the international health scene these days. It's a big hot topic, and we tell them they can get pretty much all that they would want in those international sites here in Baltimore, and they can do it right at home and make a big difference here. I think our program, the Urban Health Program, really stresses issues like substance abuse, healthcare access, issues around urban violence, issues around HIV. We'll be dealing with things like hepatitis B and C, but a lot of it stems from the underlying social determinants that really make a big difference in anywhere, especially a city like Baltimore, where There's problems with the foundations of the family. There's problems with the school system. There's problems with having jobs available for folks who want jobs. There's certainly the substance abuse issue that seems to overhang all of it, and all of those things combine into creating, and the health access issues which come along with not having the job and the education and all of those things. And all of those combine to create a really environment that health disparities can be as bad as they are, where you can see someone who lives in Roland Park, a well-to-do area of Baltimore, have an average lifespan of 83 years, and then you can look at someone who lives in Holland's Market, just on the west side of town, where the average lifespan's around 63 years, so a 20-year difference. There's obviously then a lot of work to do.
Yeah, I'll just add 2 points to that. One, just on the international versus domestic. One of the things I did before coming here was I was a Peace Corps volunteer in West Africa, and look at that. And I will say it is striking to see how many of the same issues or the same intensity of issues you're dealing with here, a block away from one of the world's greatest medical institutions. It's really quite fascinating at times. And also, I work with older adults in my job mainly, and so we see a lot of, diabetes, hypertension, not surprising, but I think that going along with what the others said, I think that it's really that access to healthcare and understanding. We do a lot of health education with what I do, and it's, amazing when you have someone who's had 70 years of not great healthcare, really trying to work with them on if they have that access, because a lot of my patients have Medicare, so they can access health care, but it's about utilizing that and knowing how to utilize that and make the best of that situation. So there are definitely lots of issues to work on. There's always tons to do.
So can I just bring up sort of a tip or something to think about as you're getting involved in the community in Baltimore? And I think one of the issues that Megan just brought up, that all of these health disparities can be seen in blocks away from Johns Hopkins, is a very important point, because the community often is still pretty wary of what's going on at Hopkins. And I think for a long time, if you asked people in the community, there would be many people who would say, they research there, they're not interested in us, you go there and things happen to you, you disappear, you don't come back. There's some real distrust from the community that is probably very reasonable from the perspective of the community members. And then beyond the sort of mistrust is the fact that you have such a rich institution, and yet there's still so much need in the city around it, and what is the institution actually doing for us? So you will encounter some of those attitudes when you're out in the community, and I think just important to keep in mind, that they see lots of people come and go to be involved in the community, and lots of people trying to fix things, and there's not always that follow through that the community would want to see.
And I would say that at Source, we're really big on sustainability. We partner with close to 100 community-based organizations. A large percentage of them are very close to this very campus, and they all work on a plethora of issues. You can almost, like you said, throw that dart and you will probably find what you're looking for, but we do have to be careful. We get a lot of students that they feel the tension, they go on a tour, and then they start to feel a little bit of that tension, like, oh, I'm from Hopkins, I'm riding in this bus and I'm passing all these vacant homes and I see these people on the streets and I want to do something, but many times they're not able to think through on the idea, and so they go with the first thing that comes to them. They start a project, then they graduate, and that's it. And the community says, oh, well, that was nice. Is somebody coming back to help us next year? Or you didn't help me learn how to take care of this issue myself. You just came in and tried to rescue me, and now I'm still where I was before you came. So we're very big on helping students when it comes to sustainability and thinking through your ideas. With that being said, I also wanted to inquire, I wanted to ask a little bit more if Megan and Mark want to add their bit about the perspective of the tensions between Hopkins and the community, and what's it like for you being in the community but also being a Hopkins community member as well.
Sure, I'll tackle that. Which is weird, 'cause I'm a part-time Hopkins student, so I get to wear both hats. There's definitely, as Lenny was saying, this history of this Hopkins. And I've been in Baltimore for about 5 years, and just within that period, there was this whole East Baltimore redevelopment. East Baltimore Development incorporated this whole sort of building this biotech park and renovating all these homes and tearing down some homes, and what that did to sort of the Mideast neighborhood, and a lot of different sort of conversations that took place from that. So there's, even today in the last 4 years, there's still this some miscommunication issues about what is sort of happening in the community perceptions versus what Hopkins is thinking is sort of their role within the community. And I would say that the trend just in a 5-year period is, I don't know if you sort of completely fix the damage that has been done over a couple hundred years of maybe some issues that have arisen, but there are, I think, maybe the priorities are shifting, or maybe there's some movement on the just high level administrative side to really actually acknowledge that there's some Hopkins community issues and to actually provide some programs to address it. Project Health being one of those that has partnered with sort of Johns Hopkins Health System to actually address the roles of access to primary care and sort of take students and get them out into the community and sort of have them more involved. There's also a program called the Access Partnership, or TAP, that is never publicized because they don't want to open the floodgates, as they say, but actually frees up Hopkins physicians to provide free specialty care to folks within certain zip codes surrounding the hospital. Which is, again, something that they don't get any credit for, and I would say Hopkins does a terrible job of actually publicizing what they do well. You only hear the bad news that comes out, whether they're bill collections that go out to sort of medically underserved patients. So there are these programs and attempts to sort of rebuild that trust, but it takes time, and I think it's slowly building there. But I think what is really an asset is to have these students, medical students, public health students, nursing students, who are sort of single PR campaigns to really help bridge that gap, to help be, you wear your Johns Hopkins hat whether you want to or not, and when you go out there interacting with community members, you have a chance to sort of help that divide. And I think that's actually trending in the right direction, and I think there's a movement to really build on that and really kind of help bridge that divide.
Yeah, I would agree with everything. I think it's just important to remember that it is a complex relationship. And I would say I've definitely felt that tension I've heard from patients, from people of, you're going to get snatched at night if you walk by Hopkins. But I've also heard so many stories of people who live in East Baltimore. They have worked at Hopkins their entire life, or their family members have. They love receiving their care at Hopkins. There are also the good stories out there. And, there's, as has been said, there's the good and the bad. And Hopkins also is the largest employer of the area, I think,
in
of
the state of Maryland.
So obviously there's more to it. I would also say I recently read a book which I really enjoyed, which is The Immortal Life of Henrietta Lacks, and I thought it did an excellent job of really capturing the complexities of that relationship, and I would highly recommend it.
Would you kind of give a little bit, because some people may not have ever heard of Henrietta Lacks or what that's about, so can you give a little synopsis for us?
Sure. So the basic idea, let's see how I do. The basic idea is that Henrietta Lacks was a woman who lived here in Baltimore nearby, and she had a very aggressive form of cervical cancer. Her cells, a biopsy of her cervix became the first immortal cell line. So you may have heard of the HeLa cells, which are named after Henrietta Lacks, because that was how cells were named at the time. And she never got any credit and her family never received anything, as was normal for the time. And so the book follows the story of this woman, Henrietta Lacks, through her illness and the subsequent years of her family living here in Baltimore, not having health insurance, the struggles of dealing of when they learned about what had happened, of the relationship with Hopkins, and really just coming to terms with that whole issue. So it's a really excellent book talking about the relationship between Hopkins and the community. Also just interesting issues of, do our cells belong to us once they leave our body and things like that. I mean, I think it was interesting on many different levels.
And I just wanted to add in, there's issues on kind of a community level, but then you have your individual interactions with patients, with community members. And, I can say that with my interactions when we had the free clinic, and when I've worked with some of our medical students who place PPDs at the Hispanic Apostolate to check for tuberculosis in patients, on an individual level, patients are extremely grateful for what they received. The free clinic that we had was doing fantastic work for the patients. The patients who we would see there were unbelievably grateful that we were taking the time to be involved. All of the Hispanic patients at the Apostolate who I've come in contact with have just been thrilled to have had the opportunity to get into the system. And so while there may be these tensions more on sort of a community level, I still think that the interactions on a one-on-one level are probably the most important in terms of not only what the patient receives, but being that sort of ombuds person from Hopkins and helping to change people's minds about what they may have heard about Hopkins in the past.
What would you say that it means then for those individual students, or even for students that are groups, kind of like the Charm City group of students? What does it mean to really partner with the community from your perspective?
I guess I'll start. I think it's just, I think part of it's the attitude that people go in with, that realizing that you are a piece of what's going on. And so working within organizations that are working here and will be working here for years to come, I think taking the time to understand the community, the people themselves that you're working with, because I think a lot of people say they learn more. I certainly have learned more myself than I think I've taught over the years that I've been working with patients here. I think you just I think educating yourself a little bit about the issues before going into the community is important, because you obviously are coming in with all this baggage that we've talked about, the good and the bad. So knowing a little bit about that before going into the community, and then just making sure that you're working with them so that this phenomenon of someone coming in and leaving and what happened to the work they were doing, that we can try to get away from that, because I think it's really can be very harmful to the community.
I think and again, the Charm City group is not part of Hopkins, but I think what they did in terms of getting into the community that I was proud of was the fact that they were really trying to have town hall meetings with community members to find out what the community wanted from an entity like this Charm City clinic. And really make that effort to make the connections with the community members, instead of coming in and saying, hey, we know how to fix stuff, this is what you do, just line up and we'll take care of you, but really having the give and take that I think is important for people then to be able to buy into what you're doing. So I thought they've done a nice job with that, and I think the sustainability part is really extremely important. And we've seen certainly with Mark's group, that it just builds on itself. When you've had such a great track record, the community really expects a lot from you, and then the volunteers know that you're going to be there and know that you're providing great services, and I think that brings out more and more folks like yourself to be involved in the community.
Yeah. I think there's an old adage, which I'll probably butcher, that when you know one community, you indeed only know one community. That your previous experience and same thing. Some skills apply and everything else, but every community is different. Every community has different sort of needs, understanding, different culture that requires a very unique set of understanding before addressing any of those issues. And to I think Lenny's point, which was a very good one, is to really meeting the community where they are, understanding what their needs are, and not making any empty promises, and also doing it in the right way, in sort of a collaborative way, where you don't if you say, what do you want, and they say, I want an ice cream shop, and sure, you can build them an ice cream shop. Do they want a free standalone magical place where all of their needs are going to be met? Sure, everyone does. So there's even a way to get community participation and community input that's done in the right way. That's actually you can meet them halfway. It's not making any sort of empty promises or not really guaranteeing them something that's unrealistic. That's not really feasible. You can provide in whatever your 1 year, 2 years, or hopefully you'll love the city so much 10-year, 30-year existence here in Baltimore.
Right, and I think the problems of the city are extremely great, and for any one of us to present to the community that somehow we're going to fix all of the problems at one time is obviously not something that can happen. And but I don't also think that should discourage us. So yeah, we might not be able to stop all the substance abuse, and not everyone might have a job, and not everyone might graduate from high school and have the opportunity to go to college, and not every family is going to have a nuclear family. But we can begin to make changes or help to improve things, even without changing everything all at once and suddenly fixing it all.
Mm-hmm.
So we've talked a lot about the community side, and I'm going to switch a little bit to talk about the student side. What would you say are some of the biggest, we'll start with the benefits of actually connecting with the community while here at Hopkins?
I think there are many benefits. First of all, I think for me, it's been really great to be able to put into practice what you're learning in the classroom, whether that's public health skills, nursing skills, medical skills, whatever it is. Being able to see how it works in the community is great. I think, and I think that just helps your own learning. I think it makes the experience that much richer to be able to experience the community and work with them. I mean, I'm actually just finishing my job where I've been the past 2 years as a community health nurse, and I am so sad to leave these people because they're like my family in many ways. They, I think you just get very connected to the community, and I think that just makes your experience better. I think also one thing that I've seen is a lot of people come to Baltimore for school and maybe are not thrilled to be in Baltimore because it doesn't necessarily have the best reputation a lot of ways. But I think that being involved in the community can help you appreciate the city and see how great it really is, and just enjoy the experience and get to see all that that it has to offer.
I wouldn't add too much to that. I mean, Baltimore has a lot of character. Nice way of putting it. And I think, you're all in this room here at your free time listening to a panel about community involvement. So, you have the interest, and I think, the benefits, like you said, sort of the applying your academic, requirements, academic learning to some hands-on practical skills. And, I think if you're here, then you I think you view that you are now whether you like it or not, you're kind of citizens of Baltimore at this point, at least for a minimum of the next year of life. So you sort of almost have an obligation, and us telling you about all of these pressing public health issues. Now you literally have an obligation to do something because we've informed you with all of these amazing public health problems that you have to work on. So yeah, there's sort of something just about being a part of the city that you now live in, and really, I think giving something back since you're a part of this world-renowned institution. Sort of, I think embedded in it. It'll really apply to a whole set of different learnings. You will even read the paper differently, watch the news differently, have a different perspective on sort of your take on the city.
And I guess the part that I would add, two things. One is our urban health residency program. Now, if you look at when medical students don't choose to do residency at Johns Hopkins and you ask them why, the first 5 things in their reasons are Baltimore, 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 Baltimore. They don't want to live in Baltimore. And what's been great about our urban health residency is that we can actually sell Baltimore for the things that we're trying to help improve. So that's from a resident perspective of residents that we're trying to bring in to train in urban health. Now, our residents who are in the hospital and primarily practice in the hospital, I think getting out into the community is so important for them to be able to get a sense of really what's going on around you. And to be in the School of Public Health, or to be in a School of Nursing learner, to be a medical student, to be a resident, and not to understand the community around you, to help to be able to figure out how am I going to put into practice what I'm actually learning, I think you're missing out on a huge opportunity. And for our internal medicine residents to see patients who come in over and over and over again into the hospital, and why is that patient coming in all the time? Why can't they just get it together? And not to be able to go into the community to try to understand some of firsthand, to be able to see it for yourself, the things that go on that often create other priorities for people than making sure that they have all of their medications when you're trying to decide if you're going to buy your medications, which can be extraordinarily expensive, or be able to pay the rent and be able to put food on the table and all those sorts of things. You can begin to really get a sense of why patients may not do as well from a health perspective as we would like them to. So I think for all of those reasons it's so important. And then just to be involved in the community and doing the volunteer work, I think we all get a lot out of that from our own self-satisfaction to know that we've helped to make the world a little bit better. So there's just so many reasons to be involved, and not many reasons not to.
And just one more quick thing, too, that I would add. I mean, Baltimore presents just very unique characteristics where we said that you're not going to fix the entire city in your time here or in a lifetime here, but there are issues that are actually very, addressable and sort of fixable and workable. Baltimore, while having great public health needs, also has a tremendous amount of resources. It has, just great organizations, great clinics, great hospitals, great community-based programs, and a lot of different energy sort of around some of these issues, whether that's an active health department or even, that's sort of a government that's sort of actually working on a lot of really cool issues, whether that's accessibility to food or addressing obesity and the violence aspect of things. There's just a lot of different components that the city is making movements on. And when you think of a city like Baltimore, it's not like a New York where there are 10 million people, and where do you begin addressing a city issue? 600,000 people, geographically isolated. You can really, while variants across neighborhood, you can kind of, actually visualize, and have a vision of what this could be, and really make a dent, I think, in the city based off of the resources that are available.
Have any of you had any issues with safety? Has that come up? I've actually had that question a little bit more this year, and I don't think people would actually raise their hands and admit it or anything like that in a public place, because you want to, seem cool. Like, I got it, I know where I am. But I've actually had more emails, and I think it has to do with the recent news and things like that. So have issues of safety ever come up for any of you? Have you encountered anything, or do you have any tips to share with people who they're like, I'm not from here?
So I can take the first crack. There's I think 2 health commissioners ago. His name was Dr. Peter Bielenson, who was health commissioner about 15 years, late 90s, early 2000s. had a great quote: "If you're not involved in the drug trade, Baltimore is a very safe city." And I think that is actually very true. I mean, there's some instances like any urban environment. There are problems like in any urban setting where there are things happen, and I think that's unfortunately unavoidable. It's sort of in most urban settings, that's just the way it is. But I think it is very it's kind of isolated. It's sporadic. When it makes news, it makes really big news. But in general, the normal sort of common sense approaches apply. Of you don't go into a neighborhood at 12 o'clock at night in this particular part of town by yourself. And I think it's a very safe place. And Hopkins does a security force is quite robust and do a fantastic job. I think that they're they cover a very wide area, that the places that sort of surround the different universities. And even when you're outside of that, if you're really embedded in the community, then there's nothing to be too concerned about if you apply basic common sense. So that would be.
Mark, have any of the folks who've worked for Project Health ever had any issues?
Zero. There was a while when we were on the Needle Exchange van where there was a shooting 2 blocks down when we were on it, but that was about it. Nothing to students, nothing directly at the various clinics that we've been at. We've been here 4 years. We've had 512 students working in that time period, and we've been all parts of Baltimore, and we haven't had any particular issue, especially if they see you as part of providing a service, going into the hospital or to the clinic, interacting with families and with patients. Like they get that you're there for a good reason, and generally you're not targeted in any particular way. And I think again, normal common sense things apply when they're traveling at night or other things and traveling in groups like that.
Yeah, there are not gangs of people roaming through the streets
looking for Hopkins students.
Looking for people to kill. It's just not happening. And as long as you're not selling heroin, you're probably going to be very safe. And I have not heard that quote from Bjornson, but I tell the same thing to all the residents who come to apply, the medical students who apply for residency positions here, that they're going to be just fine as long as they don't do anything crazy. And if you are perhaps the person who somehow got into a very bad situation and you get accosted or someone's trying to rob you, then you do the common sense things of giving them the money and not fighting back, and there are common sense things to try to make sure that you're going to be safe. But it's just not an issue for 99% of you who would want to be involved in community outreach.
Yeah, I think just to add to that, I mean, I think, yes, I personally have never had a problem. There are many times when I have felt unsafe. I do a lot of home visits to some, kind of scary neighborhoods. But, I think it's those common sense things to just remind ourselves, there is crime, so just don't go by yourself, especially at night. Put your things in your trunk before you get somewhere so that people, that's, I think, the most common crime that I've had. I know people who've had just their car, their window smashed and stuff stolen out of it. So just taking those precautions to make sure that you don't put yourself in a situation. And I know this is one thing that was, I have a lot of friends who were Peace Corps volunteers and then in Baltimore, but we were Peace Corps volunteers in small villages, and I think you get very comfortable with feeling uncomfortable, and you just have to remind yourself that if you feel uncomfortable here, it might mean something different. So just making sure to remind yourself that just take those precautions and don't put yourself in a situation where it might not end well.
And I would say the instance that made the headlines, that 23-year-old who was stabbed in Charles Village, was, that's the first I've heard of someone cooperating and still having something happen to them. That would seem like that was just a really isolated incident that again, because of the circumstances, made news. And
from there, it's about 1:05 or closer to 1:10, and I want to make sure that we open up the time for people that are here to ask questions and to pick our brains while you have us. So if there are any questions, we'll take those. Yes, ma'am.
Could you talk a little bit more about what you were, sorry, Project Health,
Sure.
what they're doing for the infant mortality rate. You said that they're instituting some new
Yeah.
programs. What?
So there's actually.
Can you repeat the question?
Yeah. She asked what I mentioned briefly in talking about the Baltimore City infant mortality rate and how we're part of this initiative that is happening around the city to decrease the infant mortality rate. So there's actually this really cool citywide, really, it's been 3-4 years in the making grassroots program to actually address this issue. It's called Be More for Healthy Babies. Google search it. It's a pretty cool, multi-tiered approach to actually address this, including social media campaigns, addressing policy issues around prenatal risk assessments, doing this sort of 3 community-targeted mobilization effort to educate about safe sleep, to educate about parenting, and sort of just basic prenatal care and things like that. Our aspect is to actually sort of come after the end of all of this education and media to address sort of just the understanding and knowledge base about sort of prenatal risks and other risks associated with infant mortality. We place students in the mother-baby unit of a hospital. We haven't selected the hospital yet. To sort of screen for some of these other high-impact areas that sort of are known to sort of be risk factors associated with infant mortality. Things like smoking, food and nutrition. Obviously there's the low birth weight and other things, but our role is to really address the resources that are available that would impact that. So that includes getting them enrolled in WIC and food stamps, getting them enrolled in home visiting programs where there's targeted outreach, enrolling in sort of smoking cessation, education about breastfeeding, a whole sorts of different components. So we're actually placing students to partner with the nurses and providers. Those who are high risk get screened positive and referred to the program where students then provide sort of an intake and assessment, link them to different resources, and then provide ongoing case support, case management through phone calls and other things to actually make sure that they're enrolled in the resources that they should be, whether that's enrolling their child in health insurance or getting them enrolled into a food pantry or some other different program to address some of those areas.
And Mark, have you mentioned yet about how students can volunteer with Project Health? If they're interested?
Sure. I mentioned it briefly, but you can contact me. We are actually sort of part of this recruitment area to sort of, again, part of a new program to get students involved, particularly in the emergency department program. But honestly, there are whole different components we have with Source, partnered with Source, that if there's a research project, any other sort of initiative that you would want to take, whether it's an evaluation, a focus group, we've done whole sorts of things, a provider. We did a provider needs assessment and a provider focus group to sort of measure their thoughts and sort of implications in our program. And there's really, we feel fortunate to have all of these great students and have this great resources at our disposal to sort of use in any sorts of component of our program. There's actually ways where you can see the families and volunteer with us, and go to projecthealth.org and send me information and we can actually discuss the volunteerism. But there are other initiatives that if you wanted to be involved, we can also talk about.
Thank you.
Thanks for letting me plug.
Any other questions? Yes.
This is to Megan about WIC.
Mm-hmm.
You said you're no longer with WIC, but when you were, what kind of opportunities are available for volunteers there, and what does one get about?
So the question was about, for the camera's purposes, the question was about opportunities with WIC in terms of volunteering and getting involved, right?
Yeah.
Okay.
The Johns Hopkins University actually runs multiple WIC sites in the city. The one where I was, it's run by the School of Nursing, and there are volunteers through that. So I'm not sure if there are opportunities outside of students who are students at the School of Nursing, but there might be.
But Source, I guess, helps to.
Are you doing a plug for?
Yeah. My guess is that you guys will help get the information out there to.
Oh, for sure. If that's something specific. Well, there are, like I said, we work with close to 100 community-based organizations. We have a weekly newsletter that comes out every Tuesday called the Weekly Service Scoop. And it lists, some people say it's too long, and that's on purpose. It's just a list of different activities and events that are going on in the community that are really easy to kind of jump in and connect with. But if you have something specific, feel free to make an appointment, or you can always come and see us. We do ask that you make an appointment, though. But contact us, and we can meet with you to kind of figure out what your ideas are and where we can get you involved. I think one of the things we haven't talked about yet is kind of barriers to getting involved. And I have my perspective based on working with students, but I wanted to know Megan and Mark. Well, Mark's part-time, right? But working, being a student and also kind of doing the involvement thing, how hard has it been? What have been some of the barriers that you've had to overcome?
Time is always a problem. And so, I think one thing I always tell students who are starting at the School of Nursing, because I work a lot more with them, is that just take the time and set something up at the beginning, because it's always more difficult to add something in later once you already have your schedule all set. And so now that the summer is kind of coming to a close, thinking about what you might want to do for the fall, I think it's great if you want to do something on a regular basis, just make that time early on to figure out what you want to do and get it in place. The other thing is, I think Source does a great job of having opportunities that are ongoing or one-time opportunities, ways to get involved where if you don't have a lot of time, you don't need a lot of time. The Tri-School Day of Service is really fun, and it's a great way to volunteer in the community it only takes one day.
Mm-hmm.
And you get to meet other people, and it's really fun.
Next one is October 2nd. Put it on your calendars. Thanks.
So, I think the main thing is it's really, really easy as a student to get caught up in everything that's going on, because you always have classes. There's always an interesting speaker. Actually, there are always 10 interesting speakers that are talking at the same time. And so just, prioritizing involvement in the community and just making it happen, because there always are opportunities.
Yeah, ditto. Just being organized. Well, I would love to have all of you apply to Project Health. It requires a certain commitment, a certain time, making different trainings. While just to volunteer, the schedule is in the evenings, 3 to 11 p.m. It's fairly flexible, but we know that that's not everyone's priority, and any involvement is I think needed, and good involvement regardless of what you get into. And definitely start early, and you're going to have to be fairly organized as far as how you structure things, because I've seen just a lot of students have stretching themselves very thin, having a difficult time balancing all of their different interests and things that they want to do, and having to unfortunately let things sort of fall off and not being able to commit to what you originally wanted. So
yeah, and just to add to that, just the one thing I would say be careful is we've talked a lot about that sustainability piece and that importance of having that regular contact. So also, while it's great to get involved, just be aware of what time you have and what kind of commitment you can make, because I've also seen a lot of students start something and then it's too much and they're not able to continue, and that's really hard for the community organizations. It's really hard for the members of the community. So just being aware of what you can do, and then when you make that commitment, following through on it, because unfortunately the community's still there just because you have an exam the next day or too much reading to do or whatever it is. Things happen and we all understand that, but just keeping in mind that the community's there waiting no matter what.
I don't think anyone's expecting your schedule to be completely solid, especially with the 8-week programs with clinical rotations always changing. So I think it's okay, but as long as you're good about communicating that to your partners, I think everything is fine with open communication. And most community organizations, especially that Source partners with, they're fairly flexible into sort of what, and they're very open about what they actually expect from you. So as long as you're doing a good job of communicating what's going on in your life, then everything usually works out pretty well.
I thought Mindy had a question. I'm sorry. Everybody wave to Mindy. She's the director of Source, as all of you know. I didn't give her a shout out when I first did my introduction, so I'm pointing to her and I'm embarrassing her. So, are there any other questions?
Let me make a point then. I'm actually quite surprised that you don't have more questions about getting involved in the community, but I think our panelists have done an excellent job covering a lot of the basic points that Jessica and I get on a very regular basis. But one of the things I want to stress, particularly because most of you are public health students in this room, is that you have an opportunity to actually integrate your community engagement into your academics. So you have a little bit more of a benefit to you than some of the med students per se in their early interest in getting involved in the community. So there are different courses in the school where you're going to be required to do a project in the community. Sometimes Jessica or I will be coming to your class and giving you a menu of options, because what we are really strong about believing in is that we want to respond to those community identified needs. So when we're talking about sustainability, our preference is not to try to understand your interest of a project, but it's first to understand what is the community need and how might you fit into that. So what we do is we work with our community partners to get them to understand some of the course projects and how they might have a need that would fit into a course project. Now, there are faculty members that don't necessarily utilize Source. So if you're in a position where a faculty member wants you to have an experience but they don't give you any context, I really encourage you to come and talk to us or make that connection, because we'll be able to better facilitate with our community partners to make sure that they're not trying to accommodate you, but that we're making this a mutually beneficial exchange. You all have heard me already talk about the Connection Community Consultants, short-term volunteerism projects that directly respond to community needs. That's a great way of doing it. The very first day of school, you're going to be seeing all kinds of internship opportunities that are available through the Baltimore Community Practicum course and phase, so I encourage you to look at those as well. Another point that I wanted to bring up, especially because we were talking about Baltimore, some of it was negative, but there's also a lot of positive that we wanted to highlight, and I don't know if that came through as much. There are countless organizations that are really tremendous assets that we have here in our own backyard. And when you get to meet people that have lived in Baltimore their entire lives, especially some of the folks that are living in the communities where the socioeconomic status is lower, they're having more challenges, you will be so impressed by the resiliency of Baltimoreans. I'm a native Baltimorean myself, and I still live in the city, and I absolutely love it. Just like any place, there's going to be pros and cons, but I think one of the things that you have to recognize about Baltimore is that you do have a caring city. You do have a lot of people that are resilient. Our nickname has been Charm City for all of the charm and character that we have. So it's a very welcoming place to get involved, particularly with these community organizations. One of the things that Source does when our panelists have told you about, oh, well, Source helps you connect. When we are connecting with community-based organizations, there's actually a process that we go through to make sure that we really are partnering and that we are meeting each other's needs. Since we're focusing on graduate-level health professional schools as well as some undergraduate nursing students, what we want to make sure is that the involvement opportunities that we're presenting to you are of the caliber of health professional students. So while there are other opportunities, as Jessica mentioned at the very beginning, to just do something that warms your heart, like tutoring, that you might not see a direct link in terms of your academics, there are a lot of opportunities that do allow you that opportunity to develop your professional skills as well as enhance them further and bring what you're learning in the classroom to the community. So definitely lots of plugs for getting involved, and frankly, the organizations, they're waiting for you. They're waiting for you to get started. And a part of that piece as well has been that when we talk about Hopkins and the love-hate, and it is there, and there's a lot of history to it, you end up falling into the category of, oh, you're a student, you're okay, because they know that you're not the person that has made all these things happen throughout history. So quite often, when we get that whole piece about Hopkins overall and the love-hate, sometimes I, as a staff member or a faculty member, get, well, Hopkins is not so great, but Mindy, you're okay. And a lot of us get that on the individual level, but especially for students. These organizations welcome you with arms open as long as that communication is there. Please don't make promises that you can't keep. So really get started early, but don't take on too much as you begin, as Megan was saying to all of you. Good points. So with that, I know we're coming to a close. There really aren't additional questions. Turn it back to Jessica.
Go ahead.
One of the programs, the HIV counseling and testing,
Mm-hmm.
I just wanted to get more information about it. How do you, when we apply and we do the training, do we get to choose the days we on our own, or is there a schedule that we have to choose from?
It's a little bit of both. The question was, what about, can I tell a little bit about HIV, the HIV counseling and testing program that Source runs? So we work with 2 locations. One of them is Chase Brexton, which focuses mostly on the LGBT community and also low-income folks in the community. And then also there is a testing program in Hopkins ER right around the corner. When you apply, the people who coordinate the sites already know that our students are coming, and they're expecting the pool from probably 100 volunteers will apply, but actually we can only take between 20 and 30. So we have to narrow it down. But they look at your schedule and they say, okay, this person says they really only want to come once a month, and it doesn't work for them. There's a commitment of 2 shifts per month, and those shifts are based on your schedule. And especially at the ER, there's the most flexibility because they work all hours of the day. Whereas Chase Brexton, they tend to get done about 7 p.m., I think is their latest night. So it does go based on your schedule, and they realize that your schedule rotates and that it changes. So it's just a matter of coordination, but they do take into account the fact that you are a student first in volunteering. But the minimum is 2 shifts. Most people are able to do more than that, especially in the ER. Especially, I think I found that nursing students really enjoy doing more shifts. Public health students can if they find the time. I think time is the biggest factor. But yes, it definitely is flexible around your schedule. Does that answer something? Is that what you're looking for? Okay.
And one more question. During your introduction, you said sometimes you have students come, identify a need, then start up a project, but once they leave, does not continue. So are you saying if we think of an idea or a project we want to go ahead with, do we have to see you probably discuss how will this program continue? And if there are 2 prospects of this program continue when I leave, I better not start.
If I had a big sign, I'd wave it and it would say yes. Yes, we definitely suggest that you do come and see us to talk about any, especially new ideas. A lot of times there are already organizations or students and groups that are doing a lot of what people suggest because there are certain things that just tend to come up over and over. If you can, please come and see us, and then we can kind of work with you to see where your idea falls into what already exists and try to merge it. If it's something brand new, then sustainability is the biggest issue, and making sure that we're partnering with the community, that it is a community identified need. That's probably the biggest factor in that. We want to make sure that it is identified by the community, and then how can we work together with them so that if it is something that is good this year, is it possible to keep it going next year? Or in some cases, there are one-time projects. Don't get me wrong. There are some things that have a start, a middle, and an end. But many times, some of the issues that we're talking about, they go on, and we have to be careful of that. So yes, we do suggest that you do come and talk with us. Yes.
Mine is a follow-up question to it. Regarding these projects, are there any that have suffered in this respect due to maybe students graduating and leaving town? Are there any like that right now?
Where there's a gap that we're trying to fill. I think I may have found someone, but maybe not. She's thinking it over. I do have an example of that. So over at Wolf Street, I don't know if it's an elementary/middle school. They have a group of med students who have been tutoring there for years. There was another student who was, she had a scholarship, and I can't think of the name of it at the moment. She was a Schweitzer Fellow, there you go. And Schweitzer Fellows receive a stipend to do a project over a course of time. And this particular fellow last year, she was from the School of Public Health, received funding, and she did a garden over at Wolf Street, which was fabulous. And the people loved it, and the kids loved it, and she spent time with the little kids doing nutrition things and also kind of gardening. Well, she left. She got a real job and moved to D.C. As a result, this garden is still there. Like, they started this garden. There are kids this year, it's another school year, but there's no coordinator. So and the school did not tell her they needed a coordinator. She kind of came to them and said, hey, would you like a garden? And they were like, sure, if that's what you want to do. And we have kids that would love to play and they want to learn. But the school didn't have extra staff to take on the garden just because she had created it. So yes, actually, that's an example of a hole that we're trying to fill. And because gardening tends to be very popular, urban gardening is pretty hip. We probably will fill it, but that does happen. Say it again, Mindy. Oh, I am. It's almost 1:30, and that if there aren't any more questions, you are free to leave. If you have any, we'll still be here for a couple more minutes. But thank you all again for coming, and we appreciate it.